Hi everybody, my name is Justin. I'm one of the massage therapists at Advanced Spine, Joint and Wellness in Medina, talking to you today about frozen shoulder, also known as adhesive capsulitis. When a patient comes to us with frozen shoulder, usually they're going to have some stiffness around the joint and the surrounding muscles. My job as the massage therapist is to help loosen up some of the restrictions in the muscle tissue, allowing for more success with physical therapy and greater success with chiropractic. To get started, one of the first muscles I'll look at when it comes to frozen shoulder is the bicep. And I'll palpate along, looking for trigger points, tension in the bicep, and releasing through there. And then another muscle would be the pectoralis minor, which can become tight. And a lot of people have a tight pec minor, and you'll see that with an internal rotation of the shoulder. And that can also make the muscles on the other side tighten up, which we'll look at in a bit. Another muscle that's important for frozen shoulder is what's called the subscapularis muscle. It is part of the rotator cuff. With this muscle, I'll do a little press and hold or trigger point therapy. And I'll also do what's called ART, active release therapy, where I will have the patient bring the arm into flexion overhead while I continue steady pressure on the trigger point in the subscap muscle. I'll have the patient do this anywhere from 3 to 5 times. And at the end, administer a stretch. Now that the patient is in prone or laying on their stomach here, this will give us access to reach the muscles on the posterior side of the shoulder. That's going to be the posterior deltoid, where I'll find some trigger points and some tension in through here. And then some of those other rotator cuff muscles, the teres minor, coming alongside the outside ridge of the shoulder blade, the infraspinatus, another rotator cuff muscle, and then up through the supraspinatus. A lot of spinatus muscles in the rotator cuff. The shoulder is a complicated joint. It has, or it should have, a lot of range of motion, and therefore there's a lot of structures attached to that. Sometimes it's even good to work in between the spine and the shoulder blade into what's called the parascapular muscles or the rhomboids. And like I said, what I'm doing is just loosening tension, trying to decrease any muscular myofascial restrictions within the tissue because of the guarding mechanism that happens when you have a joint that is locked up. This will allow for the patient to work with the physical therapy team with greater ease and also have some smoother chiropractic adjustments.